Medical misinformation has certainly become more common. Since the COVID-19 pandemic, we saw really an increase in the amount of medical misinformation being shared. And we feel that there's a real need to support our physicians, our healthcare professionals, in better addressing these misperceptions and inaccurate claims for their own health. And in witnessing the challenges and struggles that our community was having in addressing health misinformation back in 2021, we launched this new initiative to support those needs. The overall goal of the Curricular Innovation Grants is to support the development of educational resources amongst 4 member medical schools.
I've been a medical educator for many years, and when I saw the opportunity to become involved in this work, I was very excited. It combined my interest in primary care, health communication, professionalism, and medical education as a whole. And so I've been very excited to join with this project and the work of the AAMC to help its member institutions, students, and learners learn these very valuable skills.
This collaboration with AAMC has been critical to our efforts. They saw the vision and the need and created a space where all of us across the country could come together and with their support and that vision and direction could build programs that have the opportunity to change the trajectory of medical education and public health at large.
Our project is really to bring first-class science communication training with journalists and principles of science communication, along with misinformation and talking about, all the different types of misinformation that are out there, to bring those topics and concepts to learners in our organization so they can feel empowered to address misinformation in their communities with their patients. One of the big things that we're doing in our program is really encouraging our learners, students, residents, nurses, pharmacists to consider the use of social media to address misinformation.
The misinformation group came to our community champions team to offer the training to help us to better interface with patients and people in the community and when we're often encountering misinformation.
And I think as a medical trainee that's, living in the times that we're living in now, it's really important to me to know and learn early on in my career how to have these conversations.
As a student, now I can sort of start working on being able to deal with patients who have these issues, but then as I continue throughout my career, being able to further build upon the tools that I gained from working on this project.
It's so important to get to the community members, because so little of what people learn actually comes from their provider's office. So much of it is in social media, the media, what they hear from politicians, people all over. Being able to have the skill sets developed through here and getting into the community, getting into the media, doing press conferences, letters to the editor, whatever it may mean, is just getting our knowledge and our advocacy out there where people can read it and watch it, listen to it, whatever it may be, and really be that trusted source.
Our project was an interprofessional simulation-based activity that included students from medicine, nursing, pharmacy, and public health. We felt that the interprofessional approach to this activity was important because this is a challenge that all health workers face in a number of different environments.
Our ultimate product is actually a standardized patient scenario where students run through an OSCE, an observed structured clinical evaluation, where they use the pre-work that we made, which is an asynchronous online didactic tool that incorporates exemplar videos for how to do this work really well. And then they are able to come in person and run through a standardized patient scenario and practice those skills. So the innovative piece of that is actually bringing interprofessional healthcare students together to learn how to work collaboratively, work on their advanced communication skills, and specifically apply those to patients who are using misinformation.
We thought a lot about how we could take the goals for this grant to really educate students in being able to address misinformation with patients and do it in an experiential way. And so what we decided to do was to create a community health fair. and we were able to incorporate stations addressing misinformation, both related to COVID vaccination, vaccines in general, and various other aspects of women's health. Leading up to that health fair, we developed curricula to train our students, lots of role playing and scenarios that they had to practice to be able to have these kinds of conversations.
Our educators from these diverse institutions are finishing up their work. It's been now a 2-year project, and as a result, we hope to release a toolkit. These tools that will be a part of that toolkit can then be adapted for use at local institutions across our member schools and others.